but why isn't pain relief the same as healing?
Yeah. Okay. So pain relief, that can happen as soon as you take the hammer off the thumb. All right. Well, if you hit your thumb with a hammer, and maybe this is a little bit of a dumb scenario, but and you got a nice big old black and blue thumb, the pain may go away after a couple of days, but that thumb's
Yeah.
not healed. You still have
Yeah.
that residual of that thumb.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome back to the Optimal Health Guide. I'm your host, Michael, and I'm here with Josh Vance, the Optimal Health Guide. Hey, Josh, how are you doing this week?
Good. It's been a full week, definitely, but we're doing well.
Bet, that's good. Well, today we're going to be zooming out, and we're going to try to connect the full picture because we've talked a lot about clarity over the course of these last episodes and how, integral it is. So the next question comes like, what does it actually look like and take to heal? This is where a lot of people get stuck again and even again because they're only addressing one part of the problem they're facing. So today we're going to unpack, what does your body actually need, not just to feel better for a few days, but to experience a real lasting healing progress that we're wanting to be able to see. Before we get into the conversation, though, I do want to encourage people, as this is the final episode of season number 2, and we wrap that up and get ready to build out actively season number 3, we really want to hear from you. So if there's anything that you've been dealing with or trying to understand, head on over to podcast.vancept.com. You can submit your questions there. We'd love you to help us shape the future episodes that we discuss. So, all right, without further ado, let's jump in. Josh, once someone has clarity on whatever it is that's going on, whatever it kind of has been ailing them, what are the key elements that actually drive the healing that they want to experience on the other side?
Okay. So several key elements. One of them is normal movement. And I would kind of break that down into kind of two things. Normal movement patterns, in the
Okay.
sense that we have good movement patterns for, say, for example, the shoulder when we're lifting. We're using the correct muscles to do the tasks,
Uh-huh.
and the correct muscles are adequately strong enough to do the work that we're doing for that task. So they're
Okay.
producing a correct movement pattern. Second thing is the amount of movement or flexibility, and that would fall into that line a little bit. As far as I would probably break it down by saying range of motion.
Okay.
They have to have enough range of motion to do the movement, as well as a proper movement pattern in order to promote healing. When you don't have that, and you're going to end up, compensatory things are going to happen. And
Yeah.
if we're not using the right muscles, we're going to have problems.
Yeah.
So that's one thing. Another thing is the appropriate amount of strength. Obviously, we have to
Mm-hmm.
have good, strong muscles to do the jobs that we require. Now, if you're someone that does a lot of computer work, desk work, typing, things
Mm-hmm.
like that, your job demands are going to be different than someone that's laying carpet.
Yeah.
But both tasks require strength, and a fair amount of strength for those jobs that they're doing. So in the first case, they're going to probably need more upper extremity strength. So we're
Mm-hmm.
talking wrist strength, finger strength, flexibility, and all those muscles. Whereas a carpet layer,
Hmm.
their demands are going to be a little different. They're certainly
Yeah.
going to still need upper extremity strength, but they're on their knees a lot. So, education on knee pads and good movements and spine stabilization, all that. But point being, strength. We have to have good strength in order to help facilitate those normal movement patterns also that we just talked about, so that we don't have bad movement, or we aren't at risk for re-injuring again. If we don't have the strength to do everything that we need to do, maybe we're talking about the back for a second here,
Okay.
and or an ankle. This is something that I heard just the other day, repetitive sprains of the ankle,
Mm.
because the pain went away, but they didn't
Yes.
get the strength back. They didn't do enough for the strength to fully recover. And what we're talking about is time, physiology, healing. You have to have the amount of time for body to heal. Basic
Mm-hmm.
physiology, tissue healing takes 6 weeks. again, there's things we can do to slow that down. If we repetitively re-injure it, and we keep staying in pain,
Mm,
prolonging the amount of time that it takes for the tissue to heal. So we
okay.
have to have that time for recovery, for tissue healing to begin, and then gradually reloading that tissue and in a way that doesn't cause pain, but moves towards the strengthening
Yeah,
component of that. And then probably finally, we have to be good students and doing our homework regularly in the sense
I
that
see.
we're consistently doing what we need to do. If it's, icing 3 times a day or putting heat on 3 times a day, we're doing that consistently. We're
Yeah,
doing whatever exercises we need to be doing. We're doing whatever stretches we need to be doing. We're moving with good body mechanics, all those things that we're coaching people with and teaching them. We're taking those and we're applying them to not just for the sake of an exercise, but for everything that we're doing in life. So we're doing good movements all the time, which then decreases that likelihood and allows that time to heal and fully recover.
that's good. That's a good thorough picture I can see of all of the components or like the individual ingredients in the recipe to be able to get toward that recovery on the other side. Well, I'm curious. In some ways, you've already touched on the next question I want to get to, especially with that situation you described with the ankle.
Yeah,
Like they continued to re-injure because the pain had gone
yeah.
away. So if you want, you could tease even that one particular scenario out. But why isn't pain relief the same as healing?
Yeah. Okay. So pain relief, that can happen as soon as you take the hammer off the thumb. All right.
Mm,
Well, if you hit your thumb with a hammer, and maybe this is a little bit of a dumb scenario, but and you got a nice big old black and blue thumb, the pain may go away after a couple of days, but that thumb's
yeah,
not healed. You still have
yeah,
that residual of that thumb. Okay. So in a broader sense, oftentimes pain doesn't last that long. We may start with, we'll talk about that ankle sprain.
okay,
Okay, maybe they came in, they were playing softball, and they tweaked their ankle going around second base, and it's all swollen, and they're a couple weeks out now. They're starting therapy, and we're just working on pain and swelling and all that kind of stuff, getting it under control. Well, the pain goes away reasonably quick, and pretty soon, hey, I can walk a little bit better, and I don't have to use
yeah,
crutches, and that's going well, but that tissue hasn't had enough time physiologically to heal still. So
mm,
oftentimes that pain will go away sooner than the body's actually done healing physiologically. And even
that's
when
good.
we're done healing physiologically, that doesn't mean we're ready to go back to everything normal.
Yeah,
Okay, because we still have that other issue is, well, do we really have full recovery, or are we
hmm,
just to that point where we have no pain and basic tissue healing?
yeah,
So there's a little difference in that. Sometimes we feel better and then we stop, and it could
yeah,
be we stop treatment in the sense that ankle, oh, the pain went away, I'm fine, I go back to my daily life, 2 weeks later, and I saw this just the other day. They're doing something and they re-injure themselves. It happened to be their knee
hmm,
this time, but kind of the same issue. We have weakness still. It's not
yeah,
fully handled. So kind of being stuck behind that idea that, pain's gone, therefore I'm okay. Well, not necessarily.
yeah,
Also, there are things that we can do that block pain. In medicine,
mm,
there's injections, there's different
hmm,
things like that to help with pain relief. Most people choose to get help because of pain.
yeah,
That's probably the number one driver. And so if they get an injection and that helps with the pain, okay, great. We don't have pain.
yeah,
That may not be causing the underlying or helping solve the underlying issue. There's still maybe something else going more than likely that this still has to be fully addressed. Same
yeah,
thing, if we use TENS or to help with pain, that will block pain for a period of time, but we still have these other structural issues or weakness issues or mobility issues that we have to deal with in the joints to create normal movement, to
yeah.
create normal function so that that pain actually stays away and doesn't come back after a short period of time. I
Man,
think
that
that's
makes
a
so much
long,
sense. Yeah.
long way
No,
where
that
I'm
makes
at.
a lot of sense. What's funny, I'm hearing conversations that I've had with friends of mine who have had a surgery and have had to go through physical therapy on the other side, and they're hearing, oh, it's going to take you whatever X amount of weeks or X amount of months, and it feels too long for them.
Mm.
I can totally hear parts of their story as you're unpacking all that. Well, I was feeling much better, and I went along, or I was, I got this injection and I didn't have any pain anymore. I was great. And then, it ends up plaguing them further. Also thinking too, I was talking with a neighbor, elderly person who had an upcoming surgery and was being told that it was going to be will be 3 months of recovery. And she's like, I don't think I can sit still that long. But I'm glad that you're threading the needle with all of these, like, things that people can actually do to cooperate for full recovery in that way.
Real important. Real important.
Yeah, absolutely. What points, and maybe we've already identified a few of them, but where do people tend to underinvest in their recovery?
People tend to underinvest. I think, well, kind of like the people you were talking about, they don't believe how long it's really going to take.
Yeah,
I see somebody that's had a knee replacement, and the surgeon's going to say 6 to 12 months or spine surgery, probably a year. And they're thinking, oh, I'm
yeah,
young, I'm healthy, I'm this, that,
yeah,
and the other thing. And so, they have the surgery, and then 2 months after surgery, when we're in therapy, and they're like, man, why am I still hurting? I thought I was going to do better than this.
yeah,
So some of it I think is they they don't think that it's going to take as long as it's really going to take.
yeah,
And I think that's a big thing. People underestimate the length of time true healing is going to take.
yeah.
That's definitely one thing. Another thing, maybe more related to physical therapy, is not being as diligent with the things that they're supposed to be doing at home.
Mm,
And again, that could be, using the ice on their ankle.
mm-hmm.
And well, frequently I'll hear people say, well, it didn't hurt, but yet it's the size of a softball and it's all swollen and hot and boggy
Yeah,
and they should be icing, but it didn't hurt. No, you still need to be icing. So, not following through with some of the things that they're asked to do in the way of using heat or ice, or even the exercises,
mm-hmm.
the homework, if you will. Sometimes just, in fact, I just finished with an evaluation on a person who's having lots of issues. And stress is a huge issue and probably a
Mm,
component, not the sole component, but a
yeah,
contributing component of what we're dealing with in their ankle and foot because they have a tremendous amount of stress and increased cortisol levels. And we've talked about that in the past.
yeah, yeah,
Uh, you know, so, and we did talk a little bit about some things to do to start trying to manage some of those things. And
yeah.
of course, if a person's in a lot of pain and they can't sleep well, that's a,
Oh,
a
yeah,
factor,
yeah,
making sure we are getting adequate sleep and, getting enough relief so we can rest because that's when our body's healing. And again, for the long term, making sure that they fully understand how to prevent whatever it is that we've been working on from coming
mm-hmm.
back by, knowing, okay, if we have an exacerbation, well, what do we do? You know, what exercises and I should I still be doing? So kind of
Mm-hmm.
that long-term follow through in the sense of continuing with their home program
Yeah,
and making sure that they fully get and can remember, you know, how to handle an acute irritation exacerbation.
yeah.
Yeah.
Yeah, that makes sense. Well, I think maybe pivoting from some of that line of thought into, you utilize again, we've examined a full suite of techniques and services. And so, how do those different services, you've got physical therapy, diagnostics, massage, the coaching that you bring to the table, how do all of those things work together for somebody who works with you instead of competing with each other?
Okay, well, I think they're layered a little bit, and I would
Okay.
say maybe the first layer is physical therapy and doing the evaluation, we're problem solving, coming up with what are the limitations in range of motion, strength, flexibility, joint mobility, walking, neurologically, if there's a neurological insult or issue
Hmm.
going on. And then on top of that, utilizing the EMG and the musculoskeletal ultrasound to further kind of pinpoint exactly what is going on in the sense of do they have a nerve injury? Where is it? How severe is it? What part of the nerve is injured? And how does that affect the plan of care? And again,
Mm,
I think the research is like 62% of the time, a physical therapy plan of care is changed after doing an EMG or a diagnostic ultrasound. So,
I remember you
you know,
saying that. Yeah.
putting that layer on top of it to make sure we know exactly what's going on. And then as we move through that and we're getting better and our issues are resolving and we're getting closer to discharge, maybe they still are somebody that's going to have kind of some chronic pain because they had spine surgery, for instance,
Hmm.
or they've had chronic pain and they even have like a pain implant to help decrease the pain. The massage to help deal with that muscular component of
Yeah.
the muscles always being tight. So they're doing their stretches, they're doing their strengthening, but they still need some help to get those muscles to relax and not be so tight so they don't hurt so much. And then on top of that, the wellness aspect, going beyond insurance limits reimbursement, or not reimbursement. The insurance limits a patient's ability to function. Once we kind of get to that
Hmm.
basic functional level where we can do what
Yeah.
they call activities of daily living, which may be very different than, and I've had this argument with insurances even in the last month.
Yeah.
A teenager, and they're an athlete, and the
Hmm.
insurance is saying, well, they really don't need, they can do this, this, and this. I'm like, well, they're a teenager, they do sports, that is their daily activities, and you're not allowing therapy to get them past that
Wow.
surgery to fully be able to run, jump, do all these things that they want to. So
Wow.
that's where the wellness comes in, helping somebody move beyond sometimes
Yeah.
what an insurance will allow to get better at what it is that they want to be doing. And it could be, sports. I've had some semi-professional tennis players that we've in the past, and of
Hmm.
course, people that have wanted to lose weight and just become able to do more, or just kind of manage a chronic and issue, and insurance limits how much they can help they can get from physical therapy. Well, okay, so we have this wellness thing that we can do and
Yeah.
help with that status.
Wow. Okay. Well, yeah, the insurance stuff, man, threw me for a loop. It's just, I'm, so frustrated that there's such a low bar of
Yeah.
success, and then not help to get through the resources that really could help long term. Maybe we need to circle back to that in a future episode and dig into that. I want a little bit more. Okay.
Yeah.
So we've laid out so far, some of the hurdles that people may have, feeling better, quote, and then not getting the full recovery. You've really helped us to understand how all those services that you utilize integrate together. Let's throw the opposite angle then. Let's say you've got somebody who cooperates really well with all of the coaching that you bring to the table. What does a complete plan actually look like for somebody who gets great results?
The complete plan, it starts the same way. We do that evaluation. We figure out what's going on. We begin solving that. We use diagnostics as we need. We begin moving through things, being taught exercises, and here's where it's super important. They're being compliant. They're doing the
Yeah.
ice 3 times a day for 15 to 20 minutes. They're doing their exercises 4 or 5 times a week. They're doing their
Yeah.
stretching every day. They're strengthening 3, 4 times a week. They're making gains. They're communicating back how things are going. When an exercise is pretty easy, we're pushing forward to the next stage to keep pushing
Mm-hmm.
the intensity level, and the difficulty level to higher. Checking in back and forth to where we've over time, 6 weeks, 8 weeks, 10 weeks, whatever it may be, they're good. They have full function. They can do all those things that they couldn't do that they wanted to be able to do. Range of motion's beautiful, strength's beautiful. They're doing
Mm-hmm.
fabulous. There's no pain. What to do? They understand how to handle it and to prevent it from coming up again. They've taken ownership and they're willing to continue to prevent further
Yeah.
problems down the road. So they have the ownership of it. Their mindset is, I want to do this so that I stay healthy and I stay out of problems, so
Yeah.
that I stay strong, so I maintain my flexibility and even potentially continue getting stronger and more flexibility, obviously, as they do continue. I mean, that's the person that's going to get those great.
Yeah. It's interesting too, because really these characteristics that you're describing are the types of things that really do help somebody succeed in just about anything. There's like this internal
Mm.
grit, long-term vision, looking for the right kind of support and coaching and a fortitude to apply and then diligence. I mean, those are the hallmarks of success across the board. So I really can see that, but I get it too. We're human too. And
Mm.
laziness creeps in. We go easy on ourselves. I mean, there's all these things that conflict with one another, but I can see those differences there. So push a little bit further into this, then try to categorize what separates people from who fully recover from those who keep cycling through the same issues.
I think probably the first part of that would be having a thorough, full, complete understanding of what their responsibility is, what they need to do, first of all.
Yeah. Yeah.
Secondly, I think probably them like taking the bull by the horns and saying, this is mine, this is my problem, and I'm going to deal with it. I'm going to handle it. I'm going to stare it in the eyes. I'm going to face it,
Yeah.
and I'm going to take care of it.
Yeah.
I'm not going to live this way anymore. I'm going to take care of it. So that ownership of being willing to confront that problem and then begin working on it. And then just that diligence and consistency of consistently, thoughtfully, intentionally working on the issue and doing the things that they need to do.
Yeah.
That's the thing that's going to fully recover, and they're not gonna have to keep dealing with it.
That's good. That's great. I can see again, the optimal health guide that you embody right there in all of that, just encouraging somebody to rise up and to make those differences. Well, let's close the loop on all this. Again, we've talked about people struggling to be able to experience a recovery. So let's say somebody's listening to this, or they just come to one of those epiphany moments. They want to start doing what's right. What's their first step?
Okay. First step would be doing an evaluation, kind of finding out
Yeah.
what are their issues, what do they want help with, looking at what are the problems, and coming up with basically a problem list. We
Yeah.
have like I'll use the example of a person I just saw recently here a
Okay.
few minutes ago. Issues are pain when walking, 6 months or so,
Mm-hmm.
standing, limping.
Hmm.
Okay, so the problem list turns out to be tight muscles and range of motion in the
Mm-hmm.
ankle, the joint mobility, pretty much weakness throughout the entire leg, hip, ankle, everything. And then, impaired muscle mobilities. We now have these problems. And so now we turn to the solutions for them. So, we're going to talk about, okay, these are the things that we're going to do during
Mm-hmm.
in the coming weeks. We're going to do some soft tissue work to get that calf muscle to elongate, relax, not be so tight. We're going to do some
Yeah.
stretching so that we get better flexibility in it, because that's part of what's limiting the ankle motion, which is causing problems when you're walking, because you're not getting enough motion in your ankle, causing increased stress to this other tissue, which is causing your pain. So then working through that and then beginning to strengthening these other things while they're icing these inflamed,
Mm-hmm.
painful areas to calm it down, and then relearning to reuse the correct muscles so that they have a better arch support and they're using these correct muscles. So that's kind of creating the plan and developing the plan and working through the plan.
Yeah. Yeah.
Okay. We've got it all figured out. And then we're coaching them, and then they're doing it. And then over time they just do well.
Yeah. Wow, that's great. Thanks for helping us to be able to see that relief, especially relief from pain, even though it feels good, it doesn't always mean they are actually healed. So I'm hoping that somebody's listening in and hearing themselves in this and recognizing some of these other attributes that we're highlighting that need to be dealt with in order to overcome. Well, like you've heard, if you're listening here, if you're ready to move beyond the temporary fixes and actually build a plan that works, the best place to start is with clarity. And like Josh mentioned, you can get that with an evaluation to be able to help you understand what's happening in your body and to build a plan that leads to real progress. You can go to our website, vancept.com, and you can click on the links to be able to get a free consultation and begin your journey toward optimal health. Because the goal isn't just to feel better, it is to stay better. So thanks again, Josh, for helping us out. I know that every time I leave one of these, I'm thinking more about my body movements or things that I'm doing. You show up in my thoughts many times while I'm working out or working out in the yard, and I'm thinking, I need to make sure that my posture is good here. I need to remember the right movements here. And so I'm hoping that other people are benefiting from that as well. Thanks again, Josh.